I want to get to that device because it is just a really good understanding of what was wrong with the past devices and then how you can improve it. And I found this in medicine as a whole. You have these approaches, these devices that have kind of stayed the same for a long time without any updates. And with the technology we have now and the understanding, you could do so much more to improve on them. But even before we get to those improvements, let's set the stage a little bit, because UBI, or I say UVB, it's potato, potato, but ultraviolet blood irradiation therapy is not something new. It's not something even in the last 20, 30 years. You're talking about 1920s or so that started.
A century ago,
And it was quite popular, right? And we talked a little bit before we started here about why that lost its popularity, but can you share that story of how it got started, why it was used so much, and then why it went in decline until maybe recently?
Absolutely. So the history of ultraviolet was interesting when I got into it. It was really interesting, the fact that they had this back at the turn of the century, the late 1800s, they were utilizing it. And how they did that was, it's an interesting story, is that the children that were in the hospital beds, if it was a nice day, they would roll the hospital beds out onto the patio and the sun would hit them. Well, they realized the sun was helping these people, these children, get better quicker than the ones that didn't go outside. So bing, they put two and two together and started utilizing light therapy back then. And I suppose it's the same, ultraviolet blood irradiation. And they were utilizing that spectrum of light that the sun gives out, the UVC light, which is the most germicidal. So you have bacterial, which is the UVA, and then the germicidal, which is the UVC. So we've combined those two because, we don't know what you have, germs or bacteria. Diseases are all UVC, and then your impurities are the UVA. So we combine those lights at a particular spectrum that allows penetration, so that the blood it sort of activates the irradiation of the blood. And I consider it similar to when a plant generates oxygen from the sun, or, from photosynthesis, right? Yes. Photosynthesis. The sun hits the plant turns to chlorophyll. And so it's very similar to that chemical reaction. When we activate the irradiation of the light to the blood and return it back to the patient, what's happening is that it's activating the body's own self-autoimmune system. And at that point, we have done a study in Florida several years ago, and I wish I had the photos to share with you. But it's very interesting. As the blood was going back into the body, it was almost like a 4th of July firework display. It was activating all these RNA and DNA to accept the oxygen through the blood. And in theory, blood is such as oil is to an engine. Our blood is to our own health. And if we can cleanse the blood, get it distributed to all of the organs, it's going to be very helpful. Even if you aren't sick, it makes you feel better. And so
that's that's what they realized all the time back then. In the 10, 20, 30s, it was very important for tuberculosis and other types of infectious diseases that were, very common back then. And it wasn't until when, around the 40s or 50s, and the advent of penicillin and also vaccines came around, that it got basically pushed away, right?
They shadowed it. We don't want to stick anybody. We'll give them a shot, and that's it. And they go home. The dilemma was the impurities in the vaccines. I'm sure I could tell you some stories about some vaccines that did not do justice to the American people or to the global people, for that matter. So back in the 20s and 30s, they utilized this for a number of purposes. A lot was for, I'm trying to think of the name of it here. I've got acute thrombosis. You've got polio, which was amazing to me. When I read that, I went, oh my gosh, why are they not using this? A number of them, gangrene, for instance. Gangrene is very popular setting in hospitals back in the days when they didn't have the antibiotics. So the light would get rid of the gangrene. And so if you had gangrene, they gave you UVI or UV. Wound infections, skin infections. They noticed that it was doing tremendously well with that. And we've noticed that as well. I had a patient come in that she was 380 pounds, not being comfortable with herself but she had eczema from the back of her ears to her ankles. And within 4 treatments, Casper, I got to be honest, she came in and was crying because she could now wear, it was barely pink where the scabs were. Now, the problem was this. So I looked at that. The doctors were giving her a shot every month. It was $1,000 a month for that shot. The dilemma is psoriasis and eczema is coming from impurities in your body, in the blood, and it's trying to push it through from the underside of the skin. Well, they're working from the outside. A lot of therapies now, the light therapies are working from the outside. That'll take care of the outside, but you still haven't got to the stem of the issue. And so what we've done is we've identified that by irradiating their blood, we can excrete the impurities through your liver and kidney, and it won't have to come out and excrete through your skin. And so we're very good with skin conditions. We have closed diabetic legion where there was 2 gentlemen that were going to get their foot amputated, and they did not want to do that. And they started researching, and lo and behold, thank God they found us. And the guy had a 3.5 inch on the bottom of his foot opening with 1.5 inches deep. And we have photos and all, but within 12 procedures, it was closed up and you couldn't even tell that it was there. Now, the country of Canada is interested, and I'm going to be going up there in July of this coming year. I've got contacts there. They want this only for the diabetic legion folks, and they say it will save them $1.2 billion a year by not amputating and not providing prosthetics to the patients. In addition, look at the health viability of that will happen to these patients. That would have been, less one leg or one arm or whatever the case may be. So, that attracted me to the medical efficacy of what we've done. Let's help people. And if we can't, then I look at it as why not? Why did this not do to that patient what it did to another? So that's our future of a CEPI, is that we're going to be looking, and thank God we have clinics like yours, Casper, that's providing us the medical data. We're databasing this, and we're going to look at blood types. We're going to look at where you live, your living environment. Do you live near power lines? Do you have mold in your house? What's your nutritional intake? Do you take different vitamins and minerals that could be affecting you inadvertently rather than helping you? So a lot of these things, I do understand there's 1 billion of things that we could put in the database, but if we can get to a general format of what blood type A or blood type B or blood type AB, and we have to recalibrate the lights to give you maximum exposure for maximum results. And that's where we're heading with this. We know what we have, and we're starting this out the right way. We've taken it to the modern world with, we recalibrate those lights at 500 hours. We utilize our materials, which is we know will work. And so that was part of, if you go back in history, and I'm sorry to keep jumping, but if we go back in history, what I did is I took all of the doctors and the scientists that studied the UVBI and said, this is what's working the best. So I took all of the best and consolidated into the PL2020. The knot device came out in the 40s. That was one thing that kind of raised my eyebrow. In the 50s, they went into Seattle and just took all his machines, all his data, all his research, and shelved it. Now, why would you do something when the guy is getting rid of polio? He's getting rid of sepsis and MRSA and tremendous amount of underlying diseases that he was helping with.
I'll tell you why, John. It's called money. It's called greed. It's called trillions of dollars, right?
Trillions.
What has become now trillions, we know. And that's the shame of it, because when I learned about the history, and this goes beyond just UVBI And you look at so many natural healing that were really, really effective until money, greed, and other things got in the way. And of course, it was easier. Don't get me wrong. This is not suddenly you just take a pill and that's it. You feel better. And there's no, you know, way to truly patent everything like this that is natural. You just can't do it. So there isn't as much money. So, I mean, I sort of understand. I just wish there was more education like you just shared. Man, this was really effective. Maybe we should bring it back because we're seeing some problems.
If it works, why change it? You know, let's take the best of the best. And going back to my automation experience, that helps a little bit too, because I also noticed that a lot of the devices that were working, even the not device, it was a lot of maintenance to the device. In today's day and age, you know, you want people that just want to plug it in and go away and come back and unplug it and go home. The dilemma was the cleanup, the maintenance, the particular procedure that you were using. So I had to consolidate that into a modernized device that was still providing the same efficiencies of the procedure. So that was kind of hard to do. But it came about, and I think our next device, which will be the PL3000, that will be integrated into the HIPAA-compliant cloud that hopefully, if you travel around the world and as we expand our devices, I believe that centralized repository will give any clinic that has the device the capabilities of looking at the medical history, that looking at how many procedures you've had and the diseases that it's attacking and what your outcome is. So I think that's the new normal for medical facilities, is that we need to understand the patient better. And so that's what I'm going to try to do, Casper, is put my technical cap on and help us, you know, because we do, and, you know, they have the little monitors for diabetic patients. Well, we have developed a silicone bracelet that will detect the pH level of blood. It will detect your oxygen, your heart rate, and it'll link to a app on your smartphone, and we can monitor you remotely. So those are things that I think will be a benefit for people in the future.
No, it's amazing what you can do now with technology and looking into the past, right? Not trying to reinvent it and say, don't look to the ancient wisdom of others and all the discoveries going back to time, and utilizing things we know in nature are very curative.